It's crippling. People can't work, they can't focus on anything, they're forgetting stuff. It's hard to get out of bed. Imagine feeling that way every single day for weeks and weeks. A number of cases of this thing called dysautonomia are now emerging. Basically, everything seems normal, but it's not. We're a long way into the coronavirus pandemic now, but you still hear some people say, everyone who gets it is fine, who cares? Even if that was true, it's not, it's way more complicated than that. It totally discounts a rapidly emerging area of concern for experts, LongCOVID. Basically, a number of people who get COVID, even those with really mild symptoms, can develop these other bizarre illnesses that stick around for months and months. Chronic fatigue, shooting pains, shortness of breath, chest palpitations, muscle weakness, loss of taste and smell, dizziness. And it's a thing that's come to be known as COVID fog, which is neurological symptoms like memory loss, headaches, confusion, difficulty concentrating, and sensory changes. Scary, right? What's scarier is that there's a lot we don't know about long COVID. Who does it affect? How long does it last? How do we prevent and treat it? And are there any long-term consequences? We're not even sure how many people are getting long COVID. Some studies have found that almost half of people with COVID get these other long-term symptoms, and for at least 2 months afterwards.
Hundreds of thousands of people could be suffering the effects of what is now known as long COVID.
People who were running marathons at the beginning of the year, previously fit and well, didn't need any hospital admission for their COVID, but 6 months on are too fatigued to even get to the shops to buy food.
The thing that's really strange, and maybe the most concerning, is that some people didn't even know they had coronavirus until their long COVID symptoms developed. Alison Navis is a neurologist and researcher at the world-famous Mount Sinai Hospital in New York. She's been looking at long COVID since the early months of the pandemic. What she's found is terrifying. She's particularly interested in this COVID fog part of the mystery. She found that things like sluggishness or being less mentally sharp are common symptoms, as are headaches, muscle and nerve pain, loss of smell, and other sensory issues. She wrote recently for The Conversation that a number of cases of this thing called dysautonomia are now emerging. That is, impaired regulation of the nervous system controlling heart rate and blood pressure. This is the fight or flight part of the nervous system. It means that people can feel sudden sensations of a racing heart or dizziness, as though they're facing some sort of imminent danger. Adding to the mystery, Dr. Navis also wrote that many long COVID sufferers, a raft of clinical tests come back clean. Basically, everything seems normal, but it's not. Now you might be thinking, oh, being a bit tired, having stiff muscles, feeling a bit confused, is that so bad? In many cases, long COVID is much worse than just being a bit run down or feeling like you've got a cold. It's crippling. People can't work, they can't focus on anything, they're forgetting stuff. It's hard to get out of bed. And when they do, they're short of breath doing basic tasks. And even if it was something mild, something like a bad hangover, imagine feeling that way every single day for weeks and weeks, if not months and months. The world's still fighting COVID. We're all doing our bit to get towards a post-coronavirus future. But just think for a second about the enormous war that the medical community is waging. You've got doctors and nurses on the front line treating the sick and the dying. You've got lab workers doing tests for hundreds of thousands of people a day, and public health specialists working on infection control. You've got policy boffins trying to figure out how we live with this bloody thing. You've got researchers fine-tuning COVID vaccines and medical engineers trying to speed up the manufacturing and deployment of them. And now there are scientists, researchers, and critical care doctors working together around the clock to understand this whole other long COVID component. In her article, Dr. Navis said, trying to understand long COVID will help us figure out how to prevent it. Because while some people get better and their long COVID symptoms disappear, she still has patients who are sick with crippling symptoms more than a year later.